these hoses were coming out of me and were hooked up to a really big machine. Like, I can't even, it's probably the size, a little smaller than this couch, probably, so, I don't know.
How big is that?
I'm not
I don't
sure.
know, like an old big screen TV
Yeah.
when they were bigger.
And it was,
like the projection TVs.
Yeah, projection TV kind of.
it's known around here as Big Blue, but, and it's really loud. It goes doom, 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 doom all day long. So you have to get used to the noise. But these were attached to the aortic valve and something else.
Pulmonary artery.
Pulmonary, yeah. So, but it went in this way, apparently. So I don't know how they maneuvered the wires. It was probably like this.
Like that.
You're a pretty slight girl, so this is a lot of machinery there. What actually happened there?
It was push. I had to be on a feeding tube because I couldn't eat any. I just wasn't hungry, and it was making me actually pretty nauseous and stuff and all that. But it was pushing down on my stomach, so I wasn't eating. For 3 weeks that I was on it, I didn't eat any solid foods. Yeah, and yeah, so it and these are the
Bjork-Shiley mechanical valves, and actually my husband has a Bjork-Shiley when he had his heart surgery 30 years ago. It was 30 years in February.
But yeah, it's very rare. If you're on the total artificial heart, you're very well known around here because it's very rare that they use it. So.
Yeah.
Well, and then Dr. Downey said he had trouble even fitting this inside me. He had trouble closing me. So he put me under sedation for a week so I wouldn't move. So I wake up from sedation. I don't even really remember being told I was having heart surgery, to be perfectly honest. So I was waking up out of sedation and I'm like, where am I? What's going on? And Mom was sitting there and she had to break it to me right away. She's like, okay, don't move a lot because you're attached to this huge box and you're going to be on the transplant list. I'm like, what? You know, because most Marfan patients do not end up with a transplant. Just they're able to fix it.
It's just an aortic thing.
Right there, yeah. But your heart was in such bad shape that this was the only option that they could do.
They said when they went in, like, there were parts that were barely hanging on by like a thread and stuff. The infection just attacked it.
Yeah.
They said it was falling apart in their hands.
Yeah, literally. Some of the stuff that Dr. Werner did, and I'm trying to think, 9, the stuff was just fragile. So Dr. Kleiman, with his expertise in all the high-risk valve surgeries he's done through the years, my perception is that he was happy that he had this option.
Mm-hmm.
It was kind of interesting when Dr. Boyle and Dr. Downey and Dr. Kleinman were there along with Kristen and the other nurse practitioners in the hallway. They came in and talked to us and they said, well, we'll give you a few minutes, you know. And my husband and I looked at it, the decision, and we opted that Danielle, 24 hours before the surgery, told me she wanted to live, and she shared that alone with me. So I said to my husband, Dan, Danielle wants to live. We'll offer this as a bridge. She can wake up and then she can make her own decision. And you could just see the relief in the physician's body language when we said yes.